So my next patient is going to describe his concussion.
I had at least 2 concussions that I remember. One was when I was a kid, elementary school, ice skating, skates were too big, fell back, hit my head, and I remember being not right, severe headache for 2-3 days. The second one happened when I was in high school, was horsing around with some other guys at a youth church event, and we got to wrestling. I fell, and it was my head that landed on the concrete. I stood up, and it was as if someone had taken the image of what I was looking at and scrambled all the puzzle pieces around, because I wasn't able to see clearly what I was looking at. Those symptoms again also lasted a couple days, and after that I was fine. I know I hit my head a couple other times as a kid, just growing up in a farm in Pennsylvania, but those are the ones I remember. Those are the most significant.
And were you a vaginal birth?
As far as I know.
Okay, so that was the first insult to the head. So yes. You've had 2, and we hit our head throughout our life, correct, which also can be.
I also spent 9 years in the Marine Corps. Several years of that was in Marine Artillery. Close enough that even though I had hearing protection in, I could feel the blast of the sound goes right through you. You're that close. So.
Which is a blast wave injury too.
Correct.
And which is different than hitting your head. It causes more diffuse damage.
And exposed to a lot of small arms fire, machine gun fire, etc.
So we're going to examine your eyes. I'm going to take you through the eye movements, and you're going to tell me where it feels tight or where it feels off. Okay? So keeping your head perfectly still, you're going to look up with your eyes as far as you can and tell me what that feels like.
Feels okay, maybe a little tight, but...
Okay, relax. Remember that. Look down as far as you can. Don't move your head. Do it again. Look down. What's that feel like?
Well, maybe a little tight.
Okay, as much as looking up?
Less.
Okay, so the most dominant is looking up so far.
Correct.
Okay, eyes directly to the right. No, you moved you can see how he moved his head there. So go to the right again, not moving your head. What does that feel like?
It feels okay.
Okay, relax. Eyes to the left as far as you can. What does that feel like?
About the same.
Okay, now you're going to do the diagonal up to the right.
Yeah, that feels okay.
Okay, down to the left.
Well, that hurts a little bit.
Okay, is that the most one so far?
It's probably tied with the right.
Okay, eyes up to the left. What does that feel like?
That seems okay.
Okay, and eyes down to the right.
That seems fine as well.
Okay, so what was the most dominant movement that caused?
I would say probably to the right.
Okay, directly to the right.
Correct.
Okay, you're going to take your head back as far as you can now. Step away from the wall a little bit.
Okay.
As far as you can, all the way back. And you're going to take your eyes over into that position.
To the right.
Does that increase the eye restriction?
It does a little bit, yeah. Isn't that strange?
Okay, so remember that. Relax. Now you're going to chin to chest, do the same thing, eyes to the right. What's that feel like?
Not as bad.
Okay, relax. You're going to rotate your head right. Oh, as far as you can. Take your eyes over into that position. What's that do?
That feels okay.
Okay, eyes to the left. Rotate your head to the left, eyes over to the right.
That's a little bit of strain.
More than anything else you've done yet?
No, it's about the same.
Okay, relax. You know, right ear to right shoulder.
Right ear to right shoulder.
Eyes over. What's that feel like?
About the same. That feels okay.
Okay, left side bending. Eyes over to the right. Eyes over to the right.
Oh, other right.
What's that feel like?
That hurts a little bit.
So is that the most?
No, that's tied with just going to the right.
Okay, so what is the neck movement that is the most positive?
What do you mean?
Which neck movement that you did was the most positive on the eye restriction?
I think to the right.
Okay, so right side bending and eyes directly to the right.
Mm-hmm.
Okay, now you're going to cross your eyes for me, and let's see how well you can look up here so we can see. And he also has weak convergence. So now we know that your restricted eye position is eyes to the right, and your restricted neck position is right side bending. So I want you to put your eyes in that position and side bend your head. No, here. Okay, now I want you to open your mouth up as wide as you can and tell me if that increases the restriction.
It doesn't seem to.
Okay, and do the same thing and clench your jaw. Directly to the, there you go. Does that increase it?
It doesn't. Oh wait, we did it again. Like this.
Eyes to the right, right side bending and clench.
When I relax, I feel tension.
Okay, so remember that. We're going to re-examine that.
Yeah, I think there is tension there.
Okay. Okay, good. Now we're going to treat. I always examine structure before I do the procedure, and I like to take a picture of the person's face with no expression on it so that I can see exactly whether there have been any changes in structure on down the road from this procedure. When we look at his structure, when I look at his structure, it looks like his right eyebrow is higher than the left. It looks like his ears are a little asymmetrical. The one side of his face looks a little bit more developed, the right side than the left side. Lean your head back. Let's look at his nostrils. And he has a little bit of asymmetry in his nostrils too. Left nostril's bigger than the right. Okay, bring it straight again. So everybody has asymmetry in their face. And believe it or not, this procedure can change that somewhat. I don't see a deviated septum in him per se, like I see in some people. So, okay, thank you. Pattern of tightness was eyes directly horizontal to the right. I'm using one balloon, I'm going to do one inflation, and we're going to attempt to get it to go down into the nasopharynx. The balloon length, when it's tied off, should be the length of the hard palate from the back of the teeth to where the hard palate stops. It goes into the soft palate. So it's about this length. Okay, so we're inserting. And he's going to take his eyes over to the right. He's going to take a breath, and I'm going to pinch off just the one side of the nostril. Take a deep breath through your mouth and hold. And that did not go down. Did you feel clicks and pops on that?
I felt pressure. I didn't feel a pop.
Okay.
I felt like it might have been trying to pop.
We're going to do the other side. Eyes over to the right. Take a breath.
Oh,
and that started
that
to go down.
Yep.
And you heard him cough. So yes, it did.
I felt that clicks? Pop. Yep, I did.
Okay.
For sure.
Now we're going to do the second position, which is 45-degree angle, which gets the zygoma. Eyes over to the right. Take a breath. Hold. And that went, that went down, which is what we want to happen. Third is, the fourth position, directly 45-degree angle, second position. Take a breath, hold. And that didn't go down, but it was tight.
Yeah.
Okay.
All right.
Third position, directly up and back. This gets the sphenoid. Take a breath and hold. And that went down.
Man.
Did you feel clicking and popping on that? Okay. Now we're going to go back down and do the lower again. Directly in and slightly down. Take a breath, hold, and that went down. Now we're going to do the other side. Eyes over, take a breath. And that went down. So he essentially went down in all the positions. The first time I did it, he didn't go down in the lower. So now he's gone down in all the positions. So the next time that I do him, I would put a second balloon on and I would do 2 inflations. We've completed the procedure, and now what we're going to do is we're going to re-examine. So I want you to take your eyes directly to the right and tell me what that feels like. Don't move your head though. Keep your head still.
Okay.
Take your eyes to the right.
You know what? That feels better, actually.
Okay, relax. Now you're going to side bend your head to the right, directly to the right, and you're going to take your eyes over. What's that feel like?
It does feel a little better, but I can still feel some strain.
Okay, now you're going to do the jaw. You felt a little tweak when you clenched, right?
Yes.
Okay, so do it. Side bend your head, eyes over, clench. Does that feel any better?
It feels about the same, maybe a little better.
Okay, good. So you've noticed improvement from
Yes.
the procedure. Okay, good. Thank you. So I completed the procedure on you. Can you report exactly what you felt?
Yeah, so the first time you blew up the balloon, it hurt. I thought, what am I doing here? This is really painful. But then I could tell immediately that it was doing some good. And so The other times you did it, I was happy to consent, and because I knew that it was going to be well worth it. And I feel like I can breathe much better now.
Okay, thank you.